Hi, everyone. My name is Morgan Barisich. I am on our client success and strategy team here at Fathom. I'm super excited to be talking about autonomous coding today with Audra Begley at CHN. Audra, if you don't mind, would you introduce yourself to folks?
My name is Audra Begley. I am the Outpatient Coding Manager for Community Health Network. I have been in coding my entire 31-year career. I started off as an outpatient coder. I moved into a consulting role, and now I'm here with the network managing the outpatient coding department. Outpatient coding for 6 hospital facilities and outpatient behavioral health within the network. And our team consists of 33 coders, 2 lead coders, 1 educator, and a coding supervisor.
If we could go back to 2 years ago, slightly before you all engage with Fathom, what got your team interested in AI coding?
We wanted something that we could use innovation to drive efficiency, right? We're looking for a long-term solution to address workforce challenges, upcoming retirements. Coders aren't getting any younger. I think I saw somewhere where the average age of a coder is like 55 years old. Our volumes have been steadily increasing over the past several years, especially in the area of imaging. We've seen 20 to 30% increases year after year of our imaging. We're just getting a decrease in applications for coders with coding experience. And it takes a significant amount of time to train a brand new coder and a lot of resources, to get that coder up and running, to be able to confidently code. And we were looking for a solution to code our simple accounts. And we wanted to be able to utilize our certified coders on those more complex coding.
There are lots of buzzwords out there at this point on LinkedIn, on the news. What did you first think when you heard about AI coding?
That initial fear of it will take over and replace our coding jobs. There was also some skepticism around following the coding guidelines, coding quality. Is it going to match up with our coders' quality? And we definitely had to reassure our coding team, it was not the goal to replace them, but we wanted to upskill them. They could learn to code new things while technology could take over on those simple cases.
Speaking about kind of Fathom, obviously there is our baseline model, things that we typically build, but obviously when we get into discovery with different accounts, we learn that there are certain configurations that they want. And so I'm curious, are there any things that you can call out for CHN that we were able to configure for you all?
We were able to distinguish that admit diagnosis from the final diagnosis. Our admit diagnosis on the final coding of the account should reflect what's on the order. And the final diagnosis should reflect, those results of that imaging study, along with any diagnosis codes that might be needed for medical necessity, to pass CMS guidelines. Fathom randomly selected 1,000 of our accounts that had not been coded by a coder, and Fathom blind codes that same chart, and then they received the final coding from our CHN coders, and it compared both code sets. Fathom audited and calculated the accuracy rate of the blind coded accounts against CH coding, and the results were pretty outstanding.
That's actually my favorite part of our process, because I feel like it does take time to get all of the data, to train the model, to talk through guidelines. And so that's where you finally get to see kind of the proof is in the pudding.
Of those 1,000 accounts that we sent to Fathom to code, 99% of them were able to be coded. So with the automation rate, there wasn't a lot of training on the CHN side for our coders. The accounts that Fathom wasn't able to code, the coder just finished coding up on those. And then we have our own Epic internal edits too, that we stop accounts from going to billing, if it hits an internal Epic or a coding guideline edit. So I feel like very successful part of the project was those rules that we did put in place to catch those accounts, and it made the transition almost seamless.
How have things continued to shake out since the initial coding verification process?
We're still having those same excellent results in regards to automation and quality. Our automation rate, I still believe it's 99%. So yeah, we're very pleased with our results.
How much time is your team able to dedicate to other audit activities, process improvement? What does that landscape look like in that transition?
We had approximately 8 ancillary coders coding our ancillary accounts, which include imaging. And today we have about 3.5 full-time coders coding those ancillary visits, excluding imaging. And our productivity expectations for those ancillary type visits are 20 per hour. And Fathom can code in minutes our imaging of what it took approximately 5 coders working 8 hours a day. So, significant savings of coder time.
Talk to me about your team's process and kind of how do you all, and maybe with CHN and Fathom, how do we work towards auditing and monitoring things together and continuous improvement since go live?
We are continuing to perform audits on our side. Fathom continues to perform audits on their side. We validate on both ends. And as we expand with Fathom, we look to expand that auditing. Our goal is to, continue partnership with Fathom and start have Fathom code more areas for us. I feel like we've had a great relationship, open communication, regular meetings. Fathom's very quick to respond to as our needs arise. From start to finish, I feel like it was very successful. We only had a few hiccups, as with any new technology, but I feel like the quality speaks for itself along with our automation rates.
And what has surprised you the most about your partnership with Fathom?
Just the quality, the automation rate, our turnaround time, and that our metrics have far exceeded our expectations and goals. I've been able to, since implementing Fathom, we've trained several coders on different coding areas. I've got 3 coders that learned ER coding, 1 coder that went to cancer care coding, and we trained a surgery coder. And a lot of those same coders also learned LCD edits, and one of them, is doing these audits for us. So it's been very successful.
That's awesome. I don't think I realized that so much of your team had kind of been upskilled as a part of this process.
Yeah, it's been wonderful.
Thanks everyone for the session today. I hope it was informative. I'm so appreciative of your time today, Audra. Thanks so much for joining us.
You're welcome. Thank you guys. It was a pleasure to be here today.